Call with the Prairie Doc after hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show, so let's get started on what's left. A man from Humboldt asks if we could talk about vertigo.
Sure, we can talk about vertigo. Let's make sure at first it's vertigo. And there's a number of things that can look like vertigo, and the biggest one that I'm always worried about is cardiac dysrhythmia or orthostatic hypotension, which sets you up for the fall and the broken hip. But if we get to the diagnosis of vertigo,
benign positional vertigo.
Excuse me, benign positional
It's really
vertigo.
important because vertigo is actually a symptom, and it's that sensation of movement when you're dizzy and things are moving, you're spinning or the world is spinning. And there's a lot of different things that can cause that, but the most common one, again, is that benign positional vertigo.
Yeah, and the first thing I do once we determine that that is the cause is I'm a firm believer in physical therapy. They do teach the patient to do what's called Epley maneuvers. And it's great when patients can self-treat themselves.
Yeah, and it's a pretty benign thing. It just involves a certain amount of movement in a certain direction and a certain pattern, and for a lot of people that is extremely helpful.
And way safer than the meds.
Way safer than medications, and works a lot faster than medications too. And physical therapy can be extremely helpful for all kinds of different balance problems and fall reduction and strengthening, and PT is often a really good plan for people with dizziness.
A quick thing for the people watching or listening, there's a thing in geriatrics, we call it a get up and go test. If you can't get up out of your chair without using your hands on just standing up and go, you need to see your primary care doctor, who then will more than likely refer you onto a physical therapist. And you do this to decrease the risk of fractured hip, that sort of thing.
Falls and injuries.
Direct correlation. You fail a get up and go test, your risk of an orthopedic injury goes through the roof.
Yeah, it's a big problem. Here's one that's kind of near and dear to my heart because I've been dealing with this a lot lately, and I'm sure you have too. A woman from Fedora asks, there's a shortage of atenolol, my blood pressure medicine, across the nation. So my doctor changed my medications to metoprolol, which he said is the best anyway. What are your thoughts on this?
Beta blockers is kind of choose
beta
your...
blocker is a beta blocker is
well,
a beta blocker?
Somewhat like that. I'm a metoprolol sort of person, and with the generics available on it. It's not a dose-to-dose comparison.
It's pretty close.
Yeah. And it depends what the indication is for, too. Obviously, if you're just treating hypertension versus
heart disease,
a little bit different there, but both should get you to where you need to be.
Yeah. I've been running into this a lot lately, and what I've generally been doing is saying, okay, we'll make this switch, and then I want you to come in a month or so, and let's just make sure that your blood pressure is doing what we want it to be doing. And that's true pretty much any time I'm switching medications, even within the same class. The other thing I've been seeing shortages of in this furosemide, Lasix. Have you gotten?
Hasn't hit us yet in the hospital, but I know it's coming.
I've started to get faxes from pharmacies saying we can't get furosemide, we can't get Lasix. What do you want to change it to? And that's a much bigger deal, I think, than the atenolol shortage. So that's a big problem.
Yep.
So our bottom line to that is that switch is just fine.
Just fine.
Yep. All right. Thank you for joining us on our Facebook page. We appreciate all of your questions and the opportunity to answer them. Until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.